We have a list of some risks of surgery that we want to show you, and we can talk about it, gentlemen. For example, no, those are risk factors, but let's see if we can get the risks of surgery as I start reading them one by one, which is bleeding during or after surgery, blood clots. Are we finding those? Well, I'm going to just chime in here myself. So bleeding during or after surgery, that is one. Blood clots, doctor, infection, pneumonia, pancreatitis, repaired, replaced valve doesn't work correctly, and unfortunately, death. But again, let's talk about those. Maybe not as prevalent.
No, listen. Any procedure, being surgical procedure,
sure,
or an interventional procedure, carries the good, the bad, and the ugly.
I like that.
So the ugly is possible complications. Of course, we try to minimize that, but these are procedures that are extensive, and it occurs in patients most of the time today. For example, for aortic stenosis, that the patients are elderly in the 80s. So bleeding is the most common complication of surgery or any surgical procedure. But with the use of minimally invasive procedures, like that's what we do, because we're interventional cardiologists, compared to surgery, reduce that chance. But doesn't mean that it's better than surgery. It means that in certain situations, we have alternatives. And in certain situations, the minimal interventional procedure is even better than surgery. So that's why most of the time today, the American College of Cardiology, the American Heart Association, have come with the concept of heart team, which is a group of doctors of all specialties that we gather together. We look at all the information pertinent to a patient, and based on that information, we make the most proper decision, being surgical decision or being interventional decision for the care of these patients.